Hey everybody, Dan from The Overrun. I'm here with Dr. Dan Rice for the MD1 program. He's going to take us through the trauma bag that they carry on the physician response unit. So Doc, as a paramedic, why do I want you there? I've got all the stuff I can do.
You can do a bunch of things, and a lot of what needs to occur, you do. However, if the patient is stuck there, then what?
Good question.
They need a surgeon.
Okay.
And most of what a surgeon can do, as far as in the stopgap stuff, we have the ability to do with the stuff that we have here.
Cool. Can you take us
So,
through some of it?
just starting simple things. Like this is a pigtail catheter. So yeah, we can decompress pre-hospital as paramedics, but if you need to get blood out, we can do that. As far as if somebody is pinned, say, by their leg, we have the ability to do a field amputation if necessary, to actually be able to leave that scene if the patient's unstable. This is just a pelvic binder, just a little bit better and easier to secure than a sheet. However, sheets work perfectly fine.
We talked about sheet wraps on the show. Really great option for pelvic fractures.
And then if they have bleeding, say, in the pelvis or in the lower abdomen, we have the ability to put in a Roboa catheter, which is a balloon catheter that goes through the common femoral artery that we're able to put in with our ultrasound. And you feed it up the aorta, and wherever you inflate that balloon, it will actually stop all bleeding down below it.
So almost like you're clamping the aorta from the inside.
That is the exact thing that it does. But it prevents us from having to open up somebody's chest to do so. So it's a lot, lot less blood, a lot less, a lot more sterile.
A lot less drama on scene.
Yeah. And we have the ability to take it down. We can just deflate the balloon after a certain amount of time, and hopefully the body's own ability to coagulate their own blood has taken over. So once we then allow blood flow to return, they will no longer be bleeding because they'll form their own clots. So this is just the kit to go along with that. So besides that, like I said, with the chest tubes, we have chest tube trays, we have all different sizes of chest tubes. Even if we have a patient that we think might need Roboa, but they're not necessarily that unstable yet, we could put in an arterial line catheter and actually use it for invasive blood pressure monitoring. Because we all know how well the NIVP works when things are moving around.
Basically useless.
Yeah.
So basically you can get like a heartbeat by heartbeat, second by second, actual measuring of what's going on inside
Exactly.
the body.
We have the ability to hook it right up to the LifePak 12 and some 15s if they have the right wire for it. And you don't even have to check pulses at that point because you're just looking at a waveform and the number that goes along with it.
what you got, and it's completely accurate.
Yep. So between that and end tidal monitoring, there's really not much else that you need to truly know what's going on with the patient without even having to touch them.
Remember, NIVP is really inaccurate in shock states because of the way that they measure. We'll get into that later on another show.
And then beyond that, we also have this with us. This is our whole blood. Okay. It's only us and the trauma department at Cooper that actually has this. It's the equivalent of essentially 8 units of mass transfusion protocol. It provides all the clotting factors, the plasma, the cryo, etc., that we would require multiple units of blood in the hospital to give all in one.
So this gives them everything.
Correct. You bleed out whole blood, we give you whole blood. Has all the clotting factors that you could want, all the plasma. It's the very best thing that you could possibly
And
get.
that little bag is worth 8 units.
Correct.
Wow.
Yep.
So what's the benefit of whole blood as opposed to components? Like there's a lot of flight programs that talk about packed red cells, things like that. Why is this better?
Because this has all your clotting factors in it,
Okay.
all in one thing. And you know, even though we do what's called balanced resuscitation in the hospital, which is packed red blood cells, fresh flows in the plasma, and platelets, okay? Those are all separate components, and they all expire very, very quickly. This has everything plus.
Right. Cutting edge stuff. This is what's coming in paramedicine and in EMS in New Jersey. Thanks, Doc.
No problem. Thank you.